what do we need to look at in terms of research or clinical management going forward? We'll start with Ray.
I think we need to look forward at all the possible factors that may be related to adverse outcomes in our population, not only those that are clinically easy for us to measure, but all those socially implicated in a disease like this.
Okay. Thank you. Andrea?
Okay, so I think that also coming back to my former questions, I think, yes, we definitely need to know more in the long term what is going to happen, and particularly looking at vaccines. We know how to handle patients, how to manage patients, pregnant patients with COVID, with mild disease, with severe disease, etc. We don't know that much in the long term concerning the vaccine effects. At the moment, as I said, no evidence of adverse events. In the future, we don't know, but it's our job to see what may happen.
Thank you very much. Asma.
The world suffers from a huge gap in health equity, and we need to support women advocacy. We need to ensure that women's health and the health of their unborn babies are best served, whether during the pandemic or even when it's over.
Thank you. Vincenzo.
I think we need to make sure that new developments in non-pregnant adults get implemented as soon as possible in pregnant women. We saw what happened with remdesivir, with dexamethasone, with therapies that help women. Same thing with the vaccine. We can't wait weeks, months. We can even wait days. We need safety data for women, for vaccines, and for interventions. And we also need to be on the lookout for new variants, of course, and how they can affect pregnant women.
Thank you very much all. Thank you so much to our panel, to Vincenzo, to Asma, to Ray, to Andrea. We are sorry we missed Leona from this discussion, but she was very much with us and has, of course, given us a lot of contribution to the questions and answers. So I look forward very much to our next time when we can meet, perhaps in 6 months' time or 12 months' time, when we know a lot more about vaccines. Can perhaps tell us about that. Microthrombi, Vincenzo. Ray can tell us about the social demographic risk factors, and Andrea and I have been looking at the very interesting variations at the start of the pandemic between mortality ratios and actually the prevalence of the virus in the population. All these areas are still open for discussion and are going to be fascinating to understand many of the drivers underlying these differences and changes. So thank you very much, everyone. Thank you so much, ISUOG, to Kate, to Nazia, to Maxine for making this possible. And I really hope this is going to be instructive for you all that are joining us for this. Thank you very much. Goodbye from me.